Hi, I want to show you how to find the correct answer in the test which we use in Japan. This is a translation of our technique, test answering technique and tips. We have this official sample test provided by the government. This was in Japanese, but one of our friend made a translation here. Nothing Care Skills Evaluation Test, rough translation. Some of you might have seen this sample test, right? There are 6 questions as a sample. Anybody know this? Hi. And this one is our original document. This is very useful for you, or it may be useful. Let's try to find out any of these tips in your test. There are 2 patterns, a pattern of wrong answer and pattern of correct answer. If you find some expressions or words like these, you may think, oh, these are wrong answer. Or if you find some of these expressions or words, you may think, oh, this is a correct answer. That's a magic. Okay, a pattern of wrong answer. Choices which contain these words, expressions, or similar nuance are most likely wrong answers. Let's go. A kind of limitation. Only, limited to, if only such and such. Next is all, always, definitely, every time, keep, ing, keep going, continue doing, in spite of, although, in any case, regardless, even if, many times, lacking s, always, without exception, all, the more, these are this nuance. Next is a denying case. Don't have to consider, not necessary, cannot, a few, this means not much, not related, exclude, avoid, refrain from, limit, omit, prohibit, and these are not oriented, not the user oriented. At caregiver's discretion, with caregiver's values, at the sole judgment of caregiver, at caregiver's judgment, caregiver decides, based on caregiver's experience, as caregiver wants, right? These are not good, right? Next, to the user or to user's family, persuade. The caregiver shall not persuade, right? To the user, urge, prompt, instruct. To the user, tell to make efforts, encourage. To correct what the user does or intends to do. To the user, ask many questions, press questions. These are not good, right? But here, to listen is okay or very good, correct answer. In this case, to listen is okay. To ask many questions, press questions are not good, right? Next. To anyone in any situation, to generalize, more for all than for individual. Uniform, standard, same as young people. These are in many cases wrong answer. This is extreme case. Assisting all, total assistance, dry bathing of all the body, whole body bath, move to nursing care home, use diapers, speak loudly in a loud voice. These are no good. In summary, expression negative or irresponsible, such as he cannot help ing, in. Expressions absolute or without exception. These are most likely wrong answer. Example such as the most priority, the most important, such and such. The most is no good. Wrong answer. Expressions that do not value the user, family, of course, no good. Such as let them do instead of caregiver is doing, no? はい。Next is a correct answer tips. Pattern of correct answer. Choices which contain these words, expressions, or similar nuance are most likely correct answers. Let's go. Listen, very good. I listened, he listened, very good. Hear the user's hope, guess feeling of the user, interpret words of the user. These are very good. Consider, be considerate, very good. Check feelings, have a meeting, discussion. At the user's pace. These are very good, right? Even though the user is doing bad thing in some case, the correct answer is always a caregiver must listen to him. Caregiver listen to him, such and such. Oh, very good. Correct answer. Observe, confirm, check, watch over. These are very good. Here the sample. If the user tells about hallucinations, against user's hallucinations, we accept them. We must accept them, but not with denial nor affirmation. Better to say, is that so? Right? Next. Discuss with members. is important. These are very good. But be careful. The most important, this case, wrong answer. The most important is wrong. Simply is important, maybe correct answer. With the consent of the user, good. And this is very important, you know. If a choice says a good thing and cannot be wrong, you think this answer cannot be wrong, in that case it must be the correct answer. You believe it. Listen to the user, accept the user as he is, empathize with the user, hear, listen while nodding. This is very good. User's life point of view, life history, lifestyle, individuality. These are keywords for correct answer. This empathy, you know. I see you are, aren't you? These are empathy expression. Not absolute case. Basically, may do. Maybe it's also right. These are not clear. Not clear is a good answer. Team care. Oh, sorry. Not absolute. It's one of the is included. These are okay. Next is team care. In collaboration with these are good. Wrong case, you know. Let other persons do. Follow doctor's opinion. In many cases, these are wrong answers. Good one. Share information. Consult with other professions. Participate in peer counseling with other similar people. These are very good. Expressions, as in summary, expressions positive or affirmative. These, in that case, it's a correct answer. Not absolute, not clear, unclear, ambiguous. These are most likely good answer. Kind and gentle response, of course. User self-selection, self-determination. These are good. Expressions that value users, respect users' intention. These are good. Especially in case of people with dementia, to do something together with the user is a correct answer. No? Repeating. If a choice says a good thing and you cannot, it cannot be wrong. If you think, it must be the correct answer. Okay. These are very, very useful tips to find the wrong answer or correct answer, you know. Let's try to master these rules, you know. Then next, I want to show you this sample test. This is official sample test, and this is a translation. You know, not all the questions have such answering tips. There are some of them. Question 2. this has some tips, Regarding the changes in the body along with the aging, choose one correct answer. 1. Differences among individuals are few. 2. Becomes difficult to hear low sound. 3. Becomes easy to feel hot and cold temperatures. 4. Field of view becomes narrower. In this question too, there's one tip. Which do you think? Okay, this one. A few. Not much, not many. This is a wrong answer. This one. Right? A few means not much. So in this case, the correct answer was 4, but you can eliminate this one easily, right? So you choose one of these 3 choices. Okay, next. Number 3, is there any tips? Question 3. Among the explanations below for the communication, choose one appropriate answer. Let's go. 1. Always talk in a loud voice. 2. When do not understand, keep silent. 3. Listen to them, watching their facial expressions. 4. Try not to use gestures and hand gesture. You can find the correct answer by the tip, right? This one. This listen to. This is very good words. Always correct answer. Number 3, right? Yes, the correct answer is 3. Let's see more. This one. See? This always or in a loud voice. These are bad tips, right? Always and loud voice. Speak loudly. These are bad, right? These are bad. This is very good. Not to use, deny. Oh, sorry. Denying. Denying. Not. This is bad, right? Next. Question number 4. Okay. Among the explanations below for the care of excretion, choose one appropriate answer. 1. Refrain from taking water when the diarrhea. 2. For the improvement of constipation, exercise isn't effective. 3. Use positively diapers. 4. Be considerate of privacy. You understand? The correct answer tip is here. Be considerate. Bad, wrong answer tips. Refrain from. Isn't effective. Isn't. Diapers. Right? C. Let's see. はい。You can see. Refrain from bad, wrong answer. Isn't bad, wrong answer. Diapers, wrong answer. Considerate, very good answer, correct answer. This one is very easy, right? Answer is 4. Next. Okay. Question 5. Among the explanations below, when supporting to put on and off a shirt to care a person with paralysis on the left side, choose one appropriate answer. 1. Refrain from refrain from using clothes with buttons. 2. When putting on, put first the left arm through the sleeve. 3. When putting off, take off the left arm through the sleeve. 4. Provide total assistance. You must found 2 wrong bad tips, right? Here, refrain from, and this one, total assistance. These are bad answer. Answer is 2. So you must choose the correct answer from these 2 choices. Let's see. Number 5. Right. This one. Bad, refrain from, total assistance, bad. Right? Okay. Number 6. Question 6 has no tips, so I finished this. Okay, now you understand some point that I'm trying to tell you. When the people make test questions, there's a tendency to make wrong answer and correct answer. These are the same in Japan and in maybe in the world, I think. Please read these tips and master it. Bye bye.